Liver abscesses. There are two categories of liver abscess have been identified. One is amoebic, second one is pyogenic. Amoebic liver abscesses are most commonly caused by Entamoeba histolytica. Most amoebic liver abscesses occur in the developing countries of the tropics and subtropics because of poor sanitation and hygiene. Pyogenic liver abscesses are much less common but are more common in developed countries than in the amoebic type. Pathophysiology. Whenever an infection develops anywhere along the biliary or GI tract, infecting organisms may reach the liver through the biliary system, portal venous system, or hepatic arterial or lymphatic system. Most bacteria are destroyed promptly, but occasionally some gain a foothold. The bacterial toxins destroy the neighboring liver cells, and the resulting necrotic tissue serves as a protective wall for the organisms. Meanwhile, leukocytes migrate into the infected area. The result is an abscess cavity full of liquid containing living and dead leukocytes, liquefied liver cells, and bacteria. Pyogenic abscesses of this type may be either single or multiple and small. Examples of causes of pyogenic liver abscesses include cholangitis and abdominal trauma. Clinical manifestations. The clinical picture is one of the sepsis with few or no localizing signs. Fever with chills and diaphoresis, malaise, anorexia, nausea, vomiting, and weight loss may occur. The patient may complain of dull abdominal pain and tenderness in the right upper quadrant of the abdomen. Hepatomegaly, jaundice, anemia, and pleural effusion may develop. Sepsis and shock may be severe and life-threatening. In the past, the mortality rate was 100% because of vague clinical symptoms, inadequate diagnostic tools, and inadequate surgical drainage of the abscess. With the aid of ultrasound, CT, and MRI scans and liver scans, early diagnosis and surgical drainage of the abscess have greatly reduced the mortality rate. Assessment and diagnostic findings. Blood cultures are obtained but may not identify the organism. Aspiration of the liver abscesses guided by ultrasound, CT, and MRI may be performed to assist the diagnosis and to obtain cultures of the organism. Percutaneous drainage of pyogenic abscesses is carried out to evacuate the abscess material and promote healing. A catheter may be left in place for continuous drainage. The patient must be instructed about the management. Medical management. Treatment includes IV antibiotic therapy. The specific antibiotic used in treatment depends on the organism identified. Continuous supportive care is indicated because of serious condition of the patient. Open surgical drainage may be required if antibiotic therapy and percutaneous drainage are ineffective. Nursing management. Although the manifestations of liver abscess vary with the type of abscesses, most patients appear acutely ill, others appear to be chronically ill and depleted. The nursing management depends on the patient's physical status and the medical management that is indicated. For patients who undergo evacuation and drainage of the abscess, monitoring of the drainage and skin care are important. Vital signs are monitored. Deterioration in vital signs or onset of the new symptoms such as increasing pain, which may indicate rupture or extension of the abscess, is reported promptly. The nurse must administer antibiotic as prescribed. Laboratory test results must be monitored, and the nurse must educate the patient on discharge regarding signs and symptoms, management, and report to the physician in case any abnormalities find, and management of the drainage also must be educated, and importance of taking antibiotics as prescribed. Thank you.